part 3 of our terminology introduction, we will be covering the common clinical terminology components that are seen in a majority of the clinical terminologies available today. So not all clinical terminologies contain all of these components. Some may just contain some of them. Some may call them different names, but a majority have most of these represented in some kind of native format or auxiliary format available. So today we'll talk about concepts, terms, parents and child relationships, other relationships that may exist, value sets and reference sets, and mappings. Many clinical terminologies are concept oriented. They describe things and assign codes to things that are conceptually oriented. Merriam-Webster Dictionary defines a concept as something that's conceived in the mind. It's an abstract or generic idea that's generalized for particular instances. For example, you could have a concept of heart disease. You could further subdivide that into different types of heart disease, and even further you could subdivide that as well. So you could say, there's a heart disease, and a subtype of that is myocardial disease, and myocardial disease has a subtype of myocardial infarction. So there's various different ways of identifying concepts, and you can be very granular within your terminology, or you can be very generic in your terminology. It just kind of depends on the scope and use case for the terminology, how specific you get. Within those concepts, you need some way of describing them so that humans can understand what that concept is. So just a code doesn't give you any meaning behind it. So we need some way of describing what a myocardial infarction is, and you can use one or more terms in one or more language to do that. So, for example, the SNOMED CT concept, myocardial infarction, with a specific code, has a set of descriptions that are assigned to it, and those descriptions can be in Spanish, they can be in English, in different dialects of English. So we have here, the Great British dialect, and so on and so forth. So you can have as many terms or descriptions or synonyms. There's a lot of different things the terms are called in different terminologies. So terminology kind of has a terminology problem in that sense. And they often have term types associated with them. So, for example, SNOMED has what's called a preferred term, and preferred term is context dependent. So a preferred term for one person may not be the preferred term for another person. It's definitely not the same preferred term between languages in a lot of cases. So term types are important so that you can describe what that term is intended to be used for. Specifically, if a term is more generic than the actual concept you're using to describe. In some cases, a consumer-friendly term may be more generic and not as specific as the concept itself. So you want to flag those things so that they're easily identified as, maybe not preferred within a healthcare setting and more specific to a lay person. So let's talk about parent-child hierarchies. Most terminologies have some form of parent-child hierarchies. There's a few that don't, but a majority of them do have some kind of parent-child hierarchy. That can be either a monohierarchy, like you see in ICD-10-CM, where a concept within ICD-10-CM only has a single parent all the way up to the top level. There's no branching in different directions like you see in SNOMED, which is a polyhierarchy. So, for example, myocardial infarction has 4 parents within this release of SNOMED that I have pulled up here, and those have multiple parents as well, all the way up to the very top level SNOMED CT concept. So the hierarchy is needed to define that concept, to make it more understandable by both humans and computers. It gives it some structure. These hierarchies can change over time in emerging areas of medicine where definitions change. Things that are thought of one way are shifted in another way. grouping a concept together with concepts, we can assign those parents and provide that further context with help, which helps with retrieval and secondary uses of data. Additionally, some terminologies, not all, define other kinds of relationships between concepts. So, for example, within SNOMED, you have additional relationships like associated morphology or finding site, which provide extra meaning and a logical definition for a concept. A concept can be linked together to other concepts that are necessary and sufficient to define it, to give it definition. And those definitions can be used within something like a description logic classifier to check for equivalencies or redundancies within the terminology, as well as trying to assign a more complete hierarchy and eliminating redundant parents and things like that. These are sometimes called defining relationships or roles or object properties. Sometimes you may have other weaker associations that link two concepts together but aren't a part of the strict logical definition. In addition to all of the defining relationships, the things that give the concept definition, like terms and parent-child hierarchies and other relationships, there are some value sets or reference sets. SNOMED CT calls them reference sets. Elsewhere, you're going to usually see them called value sets, or sometimes you'll hear them called subsets. They identify a specific purpose for a set of concepts. So you're going to pull a set of concepts out and identify a specific purpose when you're going to use those. These lists of concepts are often developed by standards development organizations like SNOMED International or Regenstrief, or they are made available through national release centers like the NLM, UMLS, or NHS. Value sets are used in a variety of different ways. There's tons of different value sets available out there, and you can get access to them. For example, HL7 value sets are used in a variety of the HL7 published artifacts for administrative and supporting concepts, and they're available through HL7. In the U.S., there's a U.S. Value Set Authority Center, which contains value sets from a variety of sources that you can search and view and download. You can download multiple different value sets of the same type. There's multiple COVID-19 value sets out there that are available through the U.S. Value Set Authority, for example. There's not a lot of differences between the multiple different types, but there are some, so you can evaluate value sets and see which one you want to use over the others. There's also National Release Center value sets or reference sets that are available that you can get through the UK or Canada Health Infoway or the US NLM. And these are more SNOMED specific value sets. Another common terminology component are mappings, and this allows you to transfer from one clinical terminology to another, or one code set to another. They're different from terminology integration, which we've talked about in previous presentations. Terminology integration is more taking one terminology and trying to model it or integrate it within another terminology. For example, the LOINC SNOMED CT integration work that they're doing right now is more of a terminology integration rather than a mapping, although there is some mapping being done there. And mapping really supports secondary use of clinical data. So you've recorded your clinical data in one instance, and you want to transform it to another for some kind of secondary use, be that for reimbursement or research or whatever the case you have. Typically, there's some kind of use case around them, some common goal. A lot of the cases you want to have some kind of one-to-one mapping. You don't want to transform to one-to-many. You want a one-to-one exact mapping, but that's not always the case because clinical terminologies represent concepts at different levels of granularity, or in some cases will combine meanings into a single code that are not represented that way in the source terminology. So you have to be really careful with mapping, have a really clear use case, and take time to figure out what kind of mappings are needed and to what granularity you're going to go. There are standard mappings that are out there. These are things that are produced by standards organizations like SNOMED International or Regenstrief, or by national release centers like the National Library of Medicine. Typically, these things are developed for some specific national or international use case. For example, there's a SNOMED CT to ICD-10 mapping, which is more of an international use case. In the U.S., the National Library of Medicine has done a SNOMED CT to ICD-10-CM mapping, so that's very specific to the U.S. There's SNOMED CT to ICD-O, which is more international, and things like LOINC to CPT as well. Additionally, there's many legacy systems out there that have some form of what we call local codes. So these are things that were built typically using billing or drug codes, and it's meant to capture data at a specific level within their systems. They didn't necessarily implement standard terminologies like SNOMED or RxNorm or LOINC or anything like that. They've built these local data sets, and they need some way of moving that to a standard code to support semantic interoperability, to do things like assertional knowledge with clinical decision support rules, or procedural knowledge with treatment protocols and things like that. So moving forward, these legacy systems have to be converted to use these standards natively, but they still have all this legacy data that has these old local codes, and they need some kind of mapping. Still, all that data, it's been previously recorded using these old terminologies, and it can't be used unless it's been mapped in some way. And in a lot of cases, these mappings are very difficult because the local codes that they've been using are based on billing codes, and they're not really at the level of detail that's needed to consistently and accurately transform into a standard terminology. So local mappings to standard code systems are very difficult. In a lot of cases, you're just making a best attempt at representing that thing in the standard terminology. You're probably going to lose some original meaning because that original meaning wasn't really captured in the first place. So you're really taking bad data and trying to move it to something that's standard, and it's not going to be 100% successful, but it is possible, and it is something that we've done in the past, and it's not fun, but it's dealing with legacy data is never fun. And additionally, you can do some automated mapping. Mapping approaches are essentially taking terms and programmatically mapping them to a clinical terminology. A lot of cases, you're trying to use this matching algorithm and trying to meet a minimum confidence threshold, and that can be set high or low, and you have to kind of play with that to see what best matches what you're doing. A lot of times, automated mapping is just used to seed mapping projects. So these local mapping projects, for example, could be automatedly mapped to a clinical terminology, and then have a human expert review that to make sure that those are high quality and meet the use cases that you're doing. We've at West Coast Informatics have worked on mapping use cases such as public health reporting, medical coding, linking national drug databases, and so on, using automated mapping approaches. And in a lot of cases, we set the threshold around 85%. Yeah, in a lot of cases, that's pretty good. You can go even higher, up to like 95, and you have to play with it to try to figure out how much review you're going to actually do, and at what threshold does it really make sense to review and to not review. You can learn more about these projects at our website, westcoastinformatics.com/mapping solutions if you'd like to learn more. So in summary, clinical terminologies have a lot of content that is useful for accurately representing what is currently being observed or performed in patient care. Additionally, you can take what is being observed and performed and transform that using mappings. You can build your own value sets and reference sets to help you implement that data, that clinical terminology data within your systems. The components of clinical terminologies are essential in helping you reach your implementation goals. It's going to be very difficult to implement a broad, massive terminology like SNOMED CT within your system without some kind of value sets and without using terms and mappings and all the other pieces that you need to not only get data into your system but also be able to interoperate with others and transform that data for specific use cases and purposes. Thank you for watching this latest video. Please subscribe and follow us for more future content.